Well, ever since Angelina Jolie announced that she carried the BRCA1 gene, putting her at high risk of breast cancer, wait times for gene testing have absolutely skyrocketed. And that's putting pressure on the public health system. Longer wait times means that people seek to access private testing, but that can cost, as I've been saying, up to $2,000. But from today, a new affordable genetic testing program becomes available from an outfit called Pink Hope. We welcome to the program Dr. Hilda High. She is a cancer genetics specialist and the director of Sydney Cancer Genetics. And good morning to you, Hilda.
Good morning, Wendy.
So this is very good news, I suppose, for those who would like to get this kind of testing. It's become quite popular, hasn't it, this sort of genetic testing?
Yes, very much so. I think the issue is people are more aware that some cancers, not most, but certainly some, can be caused by an inherited mutation, a change in a gene that you inherit either from your mother or your father, and that results in increased cancer risk. But I think the key point that Crystal from Pink Hope is raising is that although I see patients throughout rural and regional Australia via bulk billed telehealth, and even for my face-to-face patients, a patient who's reached their Medicare safety net may be out of pocket $20 or so, I can't order a bulk billed genetic test because there's no item number. And as you pointed out, public clinics can have wait times, although they do give priority to patients making treatment decisions. There are patients who will never be eligible for those tests, even though they're very close to that cutoff. And those patients aren't always informed that the cost of testing has decreased substantially, or even that private services and self-funded testing is available.
So go back to Crystal. You mentioned Crystal's name. She's Crystal Barter. She's the founder of Pink Hope. She, at the age of 22, underwent genetic testing. She then went on to have a double mastectomy as a preventative measure. And she is behind this innovation. And can you tell me a little bit about the outfit Pink Hope and how they've been working with you?
So I work independently of Pink Hope.
Yes.
Pink Hope is a breast cancer charity, as you said, set up by Crystal, and they're raising awareness of the importance of genetic testing for some families, as well as providing support for women. My background as a genetic oncologist is purely in the clinical field. Yep. I assess people's personal and family risk, assess whether or not a genetic test may be useful, and any genetic test needs to be ordered by a doctor who assumes the medico-legal responsibility for interpreting that test, and also who provides the information about the implications and the limitations of a test, often in the company of a genetic counsellor, because it's really important to know that not finding a mutation doesn't equal no risk. You still need to provide screening advice based on the family history. But in terms of Crystal, and I think like Angelina, Crystal and Angelina inherited a mutation in a key gene, a gene that then, because of the mutation, increased their risk, not to 100%, but certainly well above the population base. That mutation was already there. Doing a genetic test allows a family to determine what their risk is, and probably just as importantly, Crystal's relatives who do not carry that mutation go back to being average risk. They don't need the increased screening, risk-reducing surgeries, or any of those sorts of things.
And, of course, you make the point there that you go and have the test and it shows that you don't have that mutation. Doesn't mean you then can do all the wrong things.
No, I think that's very important. We always emphasise lifestyle as a way of reducing cancer risk, regardless of what else is going on in the family. But you're right. I think there is a risk if testing is ordered without the benefit of genetic counselling or by somebody who's not experienced in the area, that not finding a mutation may be interpreted as the patient's not at risk. And I think it's important to point out too that sometimes we find an unexpected result or even a change that we don't really understand yet. And a public wait list is not going to get any shorter if you've got an anxious patient.
Sure. Now, tell us about the cancers that we can look at here, Dr. High. We've mentioned ovarian, breast and prostate cancer. Any others?
So I think it's important to point out that the ovarian cancer risk is substantially increased, and it includes cancers that arise in the fallopian tube.
Okay.
Those cancers are not detectable by screening, and so if you knew that you were at high risk, the only way to keep yourself healthy and safe is to remove the fallopian tube and the ovary around about the time that the risk approaches 1%. The breast cancer risk is for men and for women.
Okay.
And the men in the audience will be happy to know we don't use mammograms in men. The prostate cancer risk is also increased, and for the BRCA2 gene, there's an increased risk in the pancreatic cancers. I think also, though, some people may access a genetic test as a treatment option, and that's because there are different treatments available sometimes when a mutation in a particular gene is detected, targeted therapies.
Right. So I mean, this is a fantastic option to have. If I want this testing, can you just tell me the process that I would go through to access this particular test?
So I do bulk billed telehealth via throughout rural and regional Australia, and for my face-to-face appointments, I see patients in Sydney. But there are private clinicians working in pretty much any major city, and they also do outreach. This particular genetic test is one of many tests, and I think it's very important that patients get the right test for them. For this particular project that Pink Hope is promoting, they are also providing a co-payment for people who perhaps have been assessed within the public system and may have just missed out, or may not even be aware that our testing guidelines have changed and that they are now eligible. Though the way to go about assessing your risk is to either use the Pink Hope My Risk tool that was developed in conjunction with the Peter MacCallum Institute, and that will give you an indication of what your risk might be, or you can download a family history questionnaire from the Sydney Cancer Genetics website and discuss that with your GP. Not everybody needs or wants a genetic test. For those that are at increased risk, then the process is to organise a doctor to order the test, and for those who are not able to self-fund the test, their doctors can then refer them through the Pink Hope project and the Barbells for Boobs, who are sponsoring or co-sponsoring.
That's a great name, isn't it? Barbells for Boobs. It's great.
It is indeed.
All right. Well, that's all good news. Well, thank you very much for joining us today.
My pleasure. There's more information on the Pink Hope website and the Cancer Genetics website. And I think also it's important to point out the Cancer Institute's EviQ website, which mentions who should get a test and also how to manage the risk, is available for public and for doctors.
All right. Well, thank you very much for that.
Thank you for your time.
Thanks, Dr. Hilda High. She's the Cancer Genetics Specialist and Director of Sydney Cancer Genetics.